Introducing Celox Granules, proven to save lives and stop arterial bleeding. Uncontrolled hemorrhage remains the main cause of death for civilian adults under the age of 40. Stopping a moderate to severe bleed can challenge even experienced paramedics and emergency responders. Help is often too far away, or the casualty bleeds to death before help arrives. In some situations, severe bleeding can lead to exsanguination in under 5 minutes. Fast and effective treatment is needed to save lives. Celox is proven to stop severe bleeding fast and is trusted by militaries, emergency services, and health professionals the world over. Celox granules are designed to mold to the shape of the wound, even in complex shaped injuries, allowing use directly to the source of bleeding where pressure can be applied. Celox granules significantly and quickly reduces blood loss. In an independent in vivo trial, when compared to other popular agents and standard gauze, Celox granules gave the highest survival rate and a robust gel-like clot. Some hemostatic agents work by accelerating the body's own clotting factors, but these can become compromised in severely bleeding casualties. Celox is different. It works independent of the blood's intrinsic clotting mechanism. Celox works physically at the source of bleeding. The mechanism of action for Celox granules is through the absorption of fluid in the blood, swelling and sticking together to create a robust gel-like clot that plugs the bleeding source. Celox granules are presented in a lightweight 15-gram sachet that has a 4-year shelf life and no allergies reported to date. The following training video is a guide to using Celox granules according to the product indications and packaging instructions. When responding to a casualty, it's important to identify massive external hemorrhage as soon as possible. Fully expose the wound, identify the point of bleeding, and apply direct pressure to stem the flow and gain control of bleeding. If blood has pooled in the wound, remove the excess using plain gauze, swabs, or whatever material is available. Celox granules are indicated for moderate to severe bleeding. Familiarize yourself with the product's packaging. It has 2 tear notches, one at each top corner. While maintaining pressure on the wound, tear open the Celox granules pouch. Immediately pour the entire content of the pouch and fill the wound with granules above skin level. For larger wounds, additional pouches of granules may be used to fill the wound above skin level. As soon as the wound is filled, cover and apply firm, constant pressure for 5 minutes. Visually check for bleeding around the dressing while still maintaining pressure. If bleeding has not stopped, reapply pressure until bleeding stops. Wrap the wound using bandaging or a pressure dressing to secure and maintain pressure. Discard any remaining Celox granules. Maintain pressure at all times. Remember to bandage tightly to maintain direct pressure through to the hemostatic. Record that Celox has been used in the wound. Place the packaging inside the bandage for the next stage of care. Check periodically and reassess the wound for bleeding until reaching the next stage of care. Remember to follow these steps when applying Celox granules. Identify massive external hemorrhage. Gain control of the bleeding. Expose the wound. Identify the point of bleeding and apply direct pressure. Swab excess blood. Pour onto the source of bleeding. Cover and apply firm pressure for 5 minutes or until bleeding stops. Secure with a dressing to maintain pressure and discard any remaining Celox granules. Tuck Celox packaging into bandage. Transfer the casualty to the next stage of care. Celox granules are presented in lightweight 15-gram sachets that have a 4-year shelf life and no allergies reported to date. Celox granules are proven to save lives and reliably stop arterial bleeding. Made to save lives.